Hi, everyone. Thanks for coming. We'll get started here in about 5 minutes. If you have any questions, feel free to come off mute or use the chat. Hi, Jim. You ready? Can't hear you.
How about now? Morning, Adrian.
Hi. Good. Yeah, don't be muted. I mean, maybe for the beginning when I do my spiel, but then don't forget to unmute.
You're good. Last chance to get that cup of coffee.
Okay, it's 10 o'clock. And let's see, we have 44 participants. Jim, we had like 110 signed up. I'm wondering if we can't take 2 more minutes. I hope that's okay with everyone. Thanks for being here. 2 more minutes. Go grab a coffee. I'm going to go grab my coffee. Be right back.
This is usually the time I do a weather report around the state. So I'm at Farmington Hills, Southeast Michigan. Beautiful sunny day, little wind, perfect golf weather. Got my colorful Alaska mug from my wife.
Thanks everybody for being here today. If you haven't been to
Joanne, I don't know if it's just me, but Joanne, I think your audio kind of skipped out for a second.
Is it not
here.
good? Oh no.
Yeah, you
Hold on
froze
one
a
sec.
bit.
Right now it looks fine. It just, there was like a good 30 seconds where you were just kind of frozen for a second. And then I saw Jim and I still moving. So
What about now?
it looks okay.
Yeah, you're good.
Well, I mean, can you hear me?
Yes.
All right. Well, no one needs to look at me. You saw me. I'm adorable. Thank you. You froze, but my audio's okay. Good. You guys, look, I'm here. I swear to God, I'm a real person. I'm not yet completely automated. And you are at the download. Thank you so much for being here. Next slide, please. We'll get there.
Sorry, I apologize. My computer is not letting me advance, so just give me one moment.
Okay. Oh, this is good. Will you be able to keep moving through, Emily? That's going to be great.
Yep, looks like we're all good. Sorry for the
Okay, absolutely. So what is MiHIN? Has anybody ever thought to themselves, what even is MiHIN? Well, I asked that question about a year ago and made them hire me because I think it's super important what MiHIN is. MiHIN is a nonprofit organization that provides technology and services to connect disparate sectors, our stakeholders, to securely, legally, technically, and privately share health information. So MiHIN sits between very powerful sectors that need data to make very powerful decisions about human beings and about how they can live well and be healthy. And we are an unbiased data trustee. We convene and work to communicate between care providers. So, you know, we do this with human infrastructure and with technological infrastructure. I am the Senior Director of Outreach and Market Communications, and I will tell you that I am biased and I am way more interested in the human infrastructure. The business of data and of private data sharing and of the power of the exchange of data in our country and in the world is just starting. And it will move at the speed of trust, just like healthcare. And so we are here to make some trust happen and to understand what data is communicating and what it isn't communicating, and what information is necessary and what information is not necessary. And these are really, really tough, evolving concepts. And it is a pleasure and you know, my passion to be able to do this on behalf of the human beings of Michigan, on behalf of the human beings that care for other human beings, on behalf of our government, on behalf of the people that are paying for the care. So thank you for being here with us, and thank you for supporting MiHIN. Next slide, please.
I apologize. I'm not sure why my computer
Well, can
won't
you
let me advance.
scroll? You were scrolling before.
Yeah, I'm not too sure what's going on. I apologize about that. Let me
That's
try
okay.
one more time.
I'm gonna take over, M. So if I'm gonna boot you off, sorry.
That's totally fine.
Let's
I
see if
got
mine will work instead.
All right, thank you.
You're
Can you,
fired.
Kate? I made Emily the host.
You're gonna have to let me know. Can you see my screen?
Absolutely, Katie. Thank you. Emily, you're good. No worries. It was your computer. See what happens with technology and see how our human beings work together. I'm telling you, we see it every day.
All right. Sorry.
Okay.
So where were we? I was trying to pull this up, so I wasn't paying attention
You
fully.
can go back. I think I went through this. This is me. This
All
is what
right.
I think. You know, I talked through all this good stuff. I'm your facilitator, but I am not your expert. Today you are here to learn about Making Choices Michigan. And I am very pleased to introduce to you Jim Kraft, Dr. Jim Kraft, Director of Consumer Choice and Collaborative Care at MiHIN, the head of Making Choices Michigan. And I just want to, Jim, I don't know how you like to run your meetings, but if I like to say that if you have questions and they are so pressing that you cannot wait, I get it. And I feel like you should just ask the question. Chat with us. Feel free to engage. Discussion is where the dynamics happen. So Jim, we let us know when you want us to advance. We'll take, Katie's on the slides. Thanks a lot. And over to you. And I might be the one that's interrupting you, as you know.
Sure. Thanks, Joanne. Don't you just love Joanne? Wouldn't you like to work with her? She is so much energy. And so what I love about Joanne is that she is so curious. She's I learned from her because she asked the right questions that I'm afraid to ask. And yes, this is a great group. Thank you all for coming this morning. Thank you for the opportunity to share with you Making Choices Michigan and all that we do, all that we are. A lot of experts out here in the audience, so feel free to contribute any way you feel you want to for the benefit of the group. And if there are questions, you can either interrupt me. I'm fine with that. I won't see your hand raised, so go ahead and just interrupt, or you can put it in the chat and Katie or Joanne or somebody will bring it up at a little bit later time. So we will leave some time at the end for Q&A. So as Joanne said, my name is Jim Kraft. I have spent the last 20 years at the bedside with a major health system in Southeast Michigan, one of the oldest. So if you know your history, you know where I worked. Enjoyed being there. I worked at a couple of the hospitals there. And about 11 years ago, I got into the advanced care planning space, really as a result of my work with hospice. I was a hospice chaplain for a number of years, and I noticed that some people died better than others, and I really set myself up to figure out why that was. And it's been a lifelong learning project for me as well to discover that. And so hopefully what I bring are certainly 20 years of experience, a whole lot of research and learning and studying the data that's out there to prove that advanced care planning is a valid and worthwhile intervention. And so we're going to talk a little bit about advanced care planning later on. But today I get to introduce to you for the first time anywhere publicly, I think, Making Choices Michigan. Making Choices Michigan has been around since 2010. We'll cover that in a little bit. But we have just gone through a new rebranding process. And you'll see up there, we've got our really nice logo. And this was one of our past goals, was to be the trusted source in all things advanced care planning. And we thought about that and we realized that advanced care planning is just one aspect of a choice, of a patient choice. their selection of preferences of care at end of life or preferences for care throughout their healthcare journey is one of many, many choices that patients and individuals and families face throughout their healthcare journey. And so Making Choices Michigan seeks to become the driving force for honoring consumer choices throughout the state and nationally. And this is the important sentence: by ensuring people receive care that is consistent with their values, goals, and preferences at point of care. You know, we'll talk about the what Making Choices Michigan does, what MiHIN does, but why we do what we do is right here. At the very core of Making Choices Michigan is this concept of improving patient experiences throughout their healthcare journey. As I said, I was a bedside chaplain for 20 years, and many of you who've been in this space for any number of years, we've all seen the good, the bad, and the ugly of healthcare. We've either personally experienced the agony of somebody who was experiencing pain and suffering. We have seen individuals go through treatment plans that were not benefiting them. We've seen the agony of families trying to decide what to do this or not to do that. We've seen the arguments around the bedside of the disagreements of families. And so I made it my mission, and we've made it our mission, that we were going to improve how healthcare was delivered. And one of the ways that we do that is through advanced care planning. And so whether it's MiHIN, exchanging health information, or whether it's Making Choices of Michigan, creating documents and storing them and making them available and interoperable throughout the state, that's the what we do. But the why we do it is because we truly want to improve the patient's experience. And so we're not in competition with anyone. If you're here today and you represent an organization that's in this space, we are your allies, because if your goal is to improve the way healthcare is delivered to people so that their experience is improved and better, then we are allies in this. And so I welcome you all here today. Next slide. Making Choices Michigan was started in 2010 by my friend and colleague, Dr. Carol Robinson, who was probably one of the first people in this space in the state many years ago. And so she created Making Choices Michigan, formed Making Choices Michigan primarily in the Grand Rapids area. And Making Choices Michigan has been and continues to be a community-facing organization with approximately 14 volunteers that provide advanced care planning education and advanced care planning consults for community members anywhere now that we can do it virtually, but primarily it started in Grand Rapids area. But we have done virtual consults throughout the state, and our volunteers serve a really great service to our community by providing education and consults. Over the course of time and through the pandemic, we have pivoted to become more of a two-sided coin. We are community facing, but we are also healthcare provider facing. And so we provide resources and services for payers, for healthcare systems, for providers, for clinicians, for community members, for community-based organizations, and alike. And so we really partner with anyone who is involved with direct patient contact with individuals who are experiencing healthcare, who need to be making decisions, correct? It's not just about end of life. It's not just about creating that document that sits in a repository somewhere until someone is unable to speak for themselves. It is about the conversation and equipping people to make medical decisions throughout their medical journey, medical decisions that are based on their rules of care, based on their preferences for treatment and their desired outcomes. Next slide, please. So as I said, we have 14 volunteers, but the 2 paid staff members are Monica Ward and myself. Monica is actually my senior. She's been part of Making Choices Michigan longer than I have. I came on just in August of last year, coming from the healthcare system, but enjoy my work with MiHIN, learning a lot about healthcare exchange and the value that it brings to ultimately to our patients by providing our clinicians and others who are the caregivers with the exchange of data and to better improve their ability to serve. Next slide, please. So advanced care planning is not, and I will say this probably a couple times, it is not simply the documenting or the creation of an advanced directive. That has been the historic approach to advanced care planning or advanced directives for the last 30 years. And it's proven that just simply creating a document does not move the needle. It does not greatly improve the patient's experience. It does not greatly improve the provider's capacity to put a plan together at end of life, because many times those documents are not actionable. And so advanced care planning has been introduced probably for the last 25 years as an intervention that really forces good communication. It is the process that supports adults at any age or any stage of health, not simply end of life, with the goal to ensure that people receive medical care and mental health care that is consistent with their values, goals, and preferences. Those conversations happen throughout the course of someone's medical journey, so relatively healthy to serious diagnosis, all the way to end of life. And so we have a staged approach when we look at advanced care planning and advanced care planning training. Our approach, we use the Gunderson-Lutheran Respecting Choices methodology. And so we focus on the 3 aspects of care: healthy care, managing serious illness, and end of life. Next slide, please. So what are the benefits of advanced care planning? When somebody comes into our environment and we ask if they have an advanced directive or not, and they say no, and we ask them if they would like to enter into advanced care planning, if they were to ask us, what is the advantage to me for doing advanced care planning? Well, historically, we could say, well, it helps us to prepare us for when you're no longer able to speak for yourself. But the benefit of advanced care planning for people who are relatively healthy or traveling through a serious illness is that it allows us an opportunity to have a conversation with that individual, to find out what's important to them, to find out what their goals of care are, to find out what outcomes are acceptable and unacceptable, to find out what their fears and concerns for their possible treatment plans might be. And by having that conversation, we let them voice their thoughts and their concerns, and we document it. We document it in an advanced directive. And what that gives to the individual is peace of mind, to know that truly they were the center of attention. Truly their voice was wanted. We wanted to hear that. We wanted to know what they were thinking. We wanted to help them. And so they can be at peace of mind to know that they were truly heard. And not only were they heard, but their voice was documented. The second reason why that benefits the individual is that their advocates are better equipped. Research shows that advocates struggle immensely with decision-making on behalf of the individual. And so there's unwanted guilt. There is fear that they're doing the wrong thing, possibly doing the wrong thing, and they're not doing everything necessary. And so these conversations that happen not only with the individual, but with the advocate present, allow the advocates to hear the voice of the individual, and they become a living document, better than the advance directive, I would say. The advocate becomes a living document that hears and knows the preferences for care and the goals of care of the individual. And so when they are faced with the daunting task of representing their loved one, they can feel confident that they know what the right thing is. And the right thing is different for everyone. And the last benefit for the individual to do advanced care planning throughout the course of their healthcare journey is their providers are better informed. Their providers are better informed of who they are and what they're trying to achieve and what they're trying to avoid. And so providers are now better understanding who their patient truly is and what they're trying to achieve. And they can use their skills and their knowledge of treatments and the various approaches to addressing the health issue. And the provider can now craft a plan of care that is in better alignment with the patient's values, with the patient's preferences, and with the patient's desired outcomes. So lots of benefits for the individual. What are the benefits for the ACP provider? Well, if you look at those first three benefits, the value discussions and increased patient satisfaction and better alignment, that goes back to our initial statement of what our goal of why we do what we do is to improve and better improve the patient experience. All three of those top three have a direct effect on the patient experience because they have a direct effect on how the provider is interacting with the patient. And because they are interacting with the patient, because they are having a more robust conversation, because they are paying closer attention to the patient's goals of care and their values, they are better able to align the plan of care and provide the best care possible for that individual. And then of course, the last one, the financial benefits are there for the provider to do this work as well, as now there are some billing codes that are available for advanced care planning. Next slide, please. So why should a provider, why should anyone partner with Making Choices Michigan? And I will frankly say, because we are experienced, we are good. We have had over 20 years, I've had over 20 years in this space, and we are connected to a network of very seasoned experts throughout the state who have been working in this space for quite a while. And we have experience in every care setting possible. We have experience in the inpatient setting. We have experience in the ambulatory setting. We have experience in the outpatient setting. We have experience in the home setting. We have experience in the community setting. We have experience in the faith-based community. We have experience throughout, and we have made many mistakes, but we've had many successes as well. And so we bring that expertise together and we offer it to anybody that we work with so that we can help them to have the very best advanced care planning programs as possible. We do extensive training that leads to increased staff confidence. And I will say that we not only just add to the competencies of clinicians. I've trained over 1,000 folks. I've trained providers. I've trained nurse practitioners. I've trained nurses. I've trained social workers. I've trained care managers. I've trained clergy. I've trained community members. I have trained a variety of disciplines and individuals throughout. And while they've all walked away saying, oh, I learned a special little tip today, or you taught me a phrase, or you gave me a new way to approach a situation. I can say that almost every individual that has attended one of our trainings walks away with an increased inspiration to do the work. It's no longer a task. When they walk away from our training, not only are they more confident and competent, but they're engaged and they're inspired, and they see the value behind doing advanced care planning work, of taking the time necessary to sit down with individuals and talking with them about what's important to them and their preferences for care. And so our people who attend our trainings walk away motivated to do this work in a much deeper way than they were when they walked in. It integrates communication. One thing that advanced care planning came on the scene because of lack of communication, primarily between clinicians and patients and families. And so by integrating advanced care planning, you're forcing communication. And when you force communication, that communication happens not only on an interdisciplinary level between the care teams and between the disciplines within the care team, but it also improves the communication between the families, the individuals, the patients, their families, and the healthcare team. And that makes for good shared decision making. That makes for very good shared decision making. And the research shows that when that robust advanced care planning happens, the patient and the family satisfaction in communication, goes up exponentially. And then the final thing is, why should you work with us? Because we're going to make you better at what you do. We're going to help you improve your quality. We're going to help you improve your communication. We're going to help you improve your processes. We're going to help you improve how you go about the practice of advanced care planning. We're going to help you improve how you document it. We're going to help you improve how you store it, how you retrieve it, and how you make it available. And we're going to help you improve how you integrate it into the plan of care. So 4 great ways that partnering with Making Choices Michigan will advance your organization. We partner with anyone who's involved with patients, with families who are on a healthcare journey, right? So it's health systems, it's ambulatory care, it's emergency medicine. You can read the list there. But all of these organizations are involved one way or another with helping individuals to think through, to discuss, to document, to store, and to retrieve, and to implement a plan of care known as an advanced directive. And so any organization, we're not, as I said earlier, we're not in competition with anyone. There's a lot of great organizations out in the audience today. And I would say, they might do a better job in a particular area or meet an organization's need maybe better than I. That's wonderful. But there's going to be areas where other organizations, such as Making Choices Michigan, can provide the necessary resource for you. So next slide, please. One of the things that we have the privilege of doing is, I said earlier, we network with a number of individuals. We have, for a number of years now, been the convener of experts throughout the state who are experienced and expert in advanced care planning. And so many of these individuals, I think we have 14 health systems represented, and then a number of other organizations throughout the state where individuals who are responsible for leading the advanced care planning initiative in their respective organizations come together on a monthly basis, and we problem solve. We talk about where our challenges are. We talk about things that we're currently experiencing, and we get advice from each other. We get insights from each other on how they went about solving a particular issue or communicating or addressing particular patient family needs. And so it's a group of learners. We are experts, but we're also learners, and we come together and we problem solve together. Currently, this group has been working on the MyPost document that has just recently passed. And so we've spent a lot of time and attention on how we're going to educate our respective organizations on this new MyPost legislation. and how is it going to impact our environments, and what do we need to do? How do we need to be prepared? And so this group is working together to support each other in that. So our community practice group seeks to support ACP around the state. So again, we're not in competition with Beaumont or Henry Ford or any other organization. We all want to see each other succeed in this work because it benefits the patient and the family. And so if you are in the audience today and you are in the ACP space and you're thinking, you know, boy, I'd like to be part of a group and have support, and I'd like to be able to hear what's happening around the state in this space, we welcome you to come and join our community of practice. We don't have any goal or standards or criteria that you have to meet. If you're interested in ACP and you're interested in helping advance advanced care planning throughout the state, or if you're interested in learning more, we invite you to come and sit in and listen in and participate on whatever level you'd like. And so you can contact us at acp@mihin.org, and Monica will help you out in that. Next slide, please. So the resources that Making Choices Michigan brings, and MiHIN, Making Choices Michigan is a strategic business unit of MiHIN. And as MiHIN excels in the health information exchange, so they are excellent in the repository field. They're excellent in the exchange of those documents. Making Choices Michigan is the other side of the coin, and we provide resources that are a little further upstream. So we provide ACP education. We speak on a number of topics for clinicians or for community members that don't know much about advanced care planning or would like to learn more about advanced care planning. So we have a fairly extensive topic list of topics that we can address for ACP education. Our primary focus, and really our bread and butter, what we do the best, is that facilitator training, because it is a staged approach. And we focus in on, I really try to focus with the group that I'm talking to and get to understand the context in which they're trying to do advanced care planning, so that we can contextualize advanced care planning in that specific environment. Because ACP is not a one-size-fits-all. It's not a one-size-fits-all conversation, nor is it a one-size-fits-all program or initiative that you can just take and superimpose into your clinical environment. It really takes some planning and some understanding of the individual clinic or ambulatory setting or community setting that we're trying to embed advanced care planning in. And so in our facilitator training, we try to address that. And then we try to address the specific demographic that you and your organization are working with. Are you working with relatively healthy individuals? Are you working with seriously ill individuals? Are you working with people who are possibly in their last phase of life? We offer consulting to organizations, to clinicians, to individuals on what advanced care planning is. How can you integrate it into your practice? When is the best time to integrate it? I work fairly extensively with, and particularly with the Alzheimer's groups and with cancer groups to look at various service lines and say, in your service line, when is the best time to integrate advanced care planning? When is the best time to introduce it? When is the best time to revisit advanced care planning? And so each individual service line, cancer, COPD, geriatric, palliative, they all have specific times that are better or more advantageous for advanced care planning to take place. And so I work with consulting with those individual groups to say when and where should advanced care planning be done, and by who? Who should do it within your organization? It is not always the physician. As a matter of fact, it is usually not the physician, although they have a very important part. Many times it's a team effort. It's an interdisciplinary team effort. And then that kind of leads into the ACP design and implementation. When we sit down and we talk about your individual context and what you're trying to achieve with your advanced care planning, who you're trying to reach, that often will, a design will emerge, or the need for a design will emerge. And then we'll talk about how you can implement ACP in your specific environment. Next slide, please. So our current partnership, I'm very excited about this work. This is our current partnership is with the state of Michigan, and we are working specifically with the Medicaid beneficiary population. And we have been tasked with the opportunity to provide statewide education and an outreach campaign for Medicaid beneficiaries. Medicaid beneficiaries are a very underserved population. Often their voice is not heard. Often for a variety of reasons, trust being the main one. Often Medicaid beneficiaries do not enter into advanced care planning conversations with their healthcare teams, with individuals in their community. And so often their voice is not heard or documented. And so we have an opportunity to work with the state to provide education for those beneficiaries, and to also provide them with opportunities to engage in advanced care planning and ultimately create advanced directives themselves. Currently, the focus of our work is in Southeast Michigan. I have the privilege of working with PACE of Southeast Michigan, and we are working to integrate advanced care planning as a best practice, a standard best practice throughout the 7 PACE sites in Southeast Michigan. And their goal at PACE is to integrate advanced care planning as a normal part of their participants' care, so that every participant will have an opportunity for PACE. And I see the question in there is, what is PACE? PACE is it's the all-inclusive care for the elderly. So PACE's goal is to keep elderly patients in their homes, living independently for as long as possible. And so they have 7 sites in Southeast Michigan. There are actually throughout the state, I believe there are 14 sites throughout the state, maybe more. But each site is dedicated to keep individuals at home, with care at home. And it's a fantastic, it's the best kept secret in healthcare. So I can't get into it now because that's a whole nother presentation, but Google PACE. But we have the opportunity to integrate advanced care planning as part of our Medicaid beneficiary work throughout the 7 sites. And then from there, we hope to take it statewide. Next slide, please. So we promised that we'd get a little bit into MiPost. MiPost, for those of you who don't know, is MiPost stands for Michigan Order for, I blew that one altogether. It's a physician order for life-sustaining treatment. So it is a portable document. The legislation was passed, I believe, about 2 years ago from the state. They have been, over the last 2 years, have been working on the completion and finalization of a form, which is now complete and available online. And the rules that go along with that form have now been finalized, and they are also online and available. And so currently where MiPost is at, the state, I have the privilege of sitting with MDHHS, who is doing a fantastic job of leading a variety of stakeholders throughout the state in developing an educational rollout for MiPost. But MiPost is a very, very important document that will be coming to a healthcare institution near you, if it isn't already. It will be coming, and it will be a game changer because it is a portable physician order. It is an important document that lets the individual know. It's a document that is created between the individual and their provider. It can be also done with an advocate and the individual's advocate and a provider, but it basically states the preferences for care. And it can range from full treatment to limited treatment to comfort measures only. And so it's a very important document. I really don't have time to go into extensively, but I would encourage anybody who's interested. I would encourage anybody who's in healthcare to Google MiPost, Michigan MiPost, and educate yourself on that, and be watching for the education rollout from the state to come your way. So next slide, please. So the complete advanced care planning solution. So MiPost, MiHIN, and Making Choices Michigan really offers the full package when it comes to advanced care planning. Typically, advanced care planning or advanced directives have started in this third column, the storage and retrieval of ACD documents. And so historically, how we have approached it, how healthcare has approached it, is somebody comes into our environment and we ask them, do you have an advanced directive or not? And if the answer is yes, we ask them to bring it in so we can put it in our EMRs. And that's the approach that has been, we've used for trying to do advanced care planning work for some 30 years now. And it's provided it's proven to be pretty ineffective. Still only 30% of the population on average has an advanced directive, and even fewer than those have those advanced directives stored and retrievable in their health system's EMR. What we have seen and what the research proves is that simply the creation and storage of an advanced directive is not the best approach to patient care or the best approach to improving the patient experience. It really necessitates the first two areas of work. It first starts with the individual organization having a strategic plan to integrate ACP into your best practice, into your standard practice. It should not be a response to an event. It should not be an afterthought of, oh boy, they hit the wall, we should do an advanced care planning consult, or we should find out what their end of life, preferences are. It should be standard care for any patient in our healthcare system, starting at 18 years old and going onward. So it begins with that robust strategic plan to integrate it in. We have just introduced ACP into one of MiHIN's products, Care Convene. And if you're familiar with Care Convene, it's a fantastic product that providers have access to for a variety of different illnesses. But we have designed, we actually have just completed the design of advanced care planning modules in Care Convene, and a provider has the capacity to target a specific group of patient group and introduce them and invite them to advanced care planning to do an assessment, advanced care planning assessment through Care Convene, and even schedule their own advanced care planning consults through Care Convene. So we're really excited about this product. It's brand new. No one has used it yet except for me and some friends. And we would invite anyone on the group, if you are interested, if you know of Care Convene and are using Care Convene, or would like to learn more about Care Convene, we'd love to pilot with you and in the advanced care planning Care Convene tool, and see if we can't help you in your advanced care planning using Care Convene. So that's where it starts. It lives and dies in this second phase, in the robust discussion. Without the robust discussion between the individuals and a trained facilitator, whether that's a clinician or social worker or care manager. Without the robust discussion, the patient experience is not impacted as greatly as it could be. Primarily because the advanced directive is a much robust, much more actionable document that emerges from that conversation. And so, so this portion, this is where our training, the training that Making Choices Michigan and others offer for clinicians is very, very important, because this raises your competencies in the conversation. And then we, of course, we move over to storage and retrieval. And I see my friend Scott Brown from 80 Vault is online. 80 Vault is one of our vendors, but there are several vendors out there who are very high trust storage and retrieval. And then the last component that MiHIN really brings to this whole thing to complete the planning solution is the interoperability of the various services that MiHIN brings. 80 Vault, My Gateway, Active Care Relationships. The exchange of these ACD documents is critical when it comes to interoperability. We know that people often do the advanced care planning work in one area, but have an end-of-life experience in another area. And so the availability of those documents is critical. It will be even more critical as MyPost takes more and more precedence in the state. And so you can see that it is not just simply, do you have an advanced directive? Yes, no, let us put it in our EMR. It is a complete package that we offer with advanced care planning. Next slide, please. So I'm going to yield over to my colleague, Monica Ward, who is going to introduce you to our upcoming training events, and then we'll close out. Monica, are you there?
Yeah, I'm here. Can you hear me?
I can hear you.
We sure
Okay,
can.
Thank you. Hi, everyone. As Jim mentioned, my name is Monica Ward. I'm the program manager for Making Choices Michigan. I work very closely with Jim. Something that we have coming up and we've been consistently doing are our ACP facilitator training courses. Our upcoming ones that we have coming up this fall, we have a First Steps ACP Facilitator training course on September 26th. And we also have a Next Steps ACP Facilitator training course on October 24th. We usually gear the First Steps training towards community members or people who are interested in getting the certification to have these facilitated training conversation or these facilitator conversations. And the Next Steps is usually geared towards more healthcare professionals and people who have previously done training as well. If you're interested in learning more or registering for a course, you can either contact us at our email, which I think was pasted in the chat earlier. It's the acp@mihin.org email address, or you can learn more on our website, which is also pasted there. And I will also paste in the chat.
Thanks.
If you'd like to be involved with our community ACP community of practice, or if you have questions about advanced care planning or any of the services that Making Choices Michigan offer, Monica is the expert resource for that. She can steer you in the right direction. And also, if you have individuals from your community that desire to have an ACP consult with a trained facilitator, Monica can also coordinate that as well. She is a wealth of knowledge and a great colleague to work with. So next slide, please. So I want to kind of wrap this up and then we can open it up for some Q&A regarding making choices and where we're going in the future. We have historically, and we will always focus on the patient experience, anything that we can do to improve how people experience their healthcare journey, whether it's through the exchange of healthcare information, whether it's through training, whether it's through one-on-one consultations, in whatever tool that we use, whether it's CareConvene or or 80 volt or acres, whatever tool we use, our goal is to improve how people experience healthcare. We know that we don't do healthcare as well as we'd like to. And so any way that we can improve it, we want to. And more, we know that consumers are going to need to be educated and informed about their choices that are available to them. Healthcare is ever changing. It is very confusing for the average person. It's very confusing for people who are involved in healthcare. And so the more education, the more that we can help our patients, our individuals, our families, our communities understand what their choices are, what are the advantages of sharing their healthcare information. How does it benefit them? Why is it important that we share our consents to access to healthcare data? Why is it important to me as an individual? How will it improve my healthcare and how people interact with me? We, as more and more consumers are educated and informed about the importance of sharing their information, then the likelihood of them trusting us with their valuable thoughts and concerns and preferences, they're going to trust us more, and they're going to make us the vehicles in which we are committed to helping them in their healthcare journey. Technology is just not a tool that captures patient choices and creates a pathway for choices. Technology, as Joanne started the very first of the conversation, technology is the tool that we humans get to use to make us better at what we do. To connect us with the passion that drives us. To connect us with the motivation that drives us to do the work we do. Technology is a wonderful tool, but it is only wonderful in the hands and in the hearts of the people of this audience. MiHIN, Making Choices Michigan, brings that technology at your fingertips. We encourage you to take advantage of it, obviously, but we encourage you to do the work that you're doing. If we can help you in any way to make you better at what you do, to encourage you, to strengthen you, to help you solve problems, then we want to be here as a resource for you. But most of all, we just want to encourage you to keep up the work that you're doing. And if we can partner in any way, please reach out to us. So with that, I will say thank you for your time and your attention. I know that the chat has been blowing up there, so I'm going to stop there and let Joanne take over. Joanne, you want to wrap this thing up? And
sure, yeah. I'd like to kind of open it up. One of the things that we've been talking about as we work to integrate Making Choices Michigan and the flow of electronic information is sort of where the Advanced Care Directive, or where all this work gets lost. And it's come up, it's come up in some of our work groups. How larger health systems or how hospitals like reach back into the good work that's been done and the trust that's been built on behalf of like their shared clients. And so I'd love to talk to anybody here that has good examples of where the advanced care planning process, we were lucky enough to have it take place. And then people came back to it again at a different point in that patient's sort of like healthcare journey. How does it work? Where is it working well? And how can like where you access the very basic information, how does that help, or how does it not help? Any good ideas? Anybody doing advanced care planning really well that wants to like share for the good of the group?
So I can probably interject there, Joanne. Tony Miles asked if I could provide one or two examples of the issues that arise in facilitated discussions and evidence that discussions work. So I'll give you a typical illustration of a conversation. Individual comes in and says, I don't want to die like Uncle Lou. And it's like, well, okay, well, tell me how Uncle Lou died. And Uncle Lou died in the hospital. He was hooked up to a bunch of machines and tubes, and he was in all kinds of physical distress, and the family was in all kinds of distress. And so I don't want to die like Uncle Lou. And so the facilitator might ask the question, well, then how would you like to die? How would you like to end your last days? And the individual will say, well, I want to be made comfortable. I don't want to be in any pain or any distress, and preferably I'd like to be at home. Well, obviously you can see that unless we clarify, whether or not you are want to enter into hospice, or whether or not you want to die at home, if you go to the hospital, if you have a life event and you go to the hospital, unfortunately, you're going to be hooked up like Uncle Lou to a lot of machines. And that is going to be your experience. So let's talk about that scenario. If that's a scenario you're trying to avoid, then how might we mitigate that experience? And so advanced care planning kind of works through some of those various scenarios that are very common throughout, and particularly with specific illnesses. They're very common experiences that happen that individuals, can say, okay, if this scenario ever happens, and then they turn to their advocate and they say, if that scenario ever happens to me, don't be aggressive. I don't want you to pull the plug on me. I don't want you to kill me, but don't be aggressive in trying to keep me alive artificially. And so by going through various experiences and various scenarios in the guided conversation, you can really help that process. I don't know, Tony, if that helped answer the question or not. I see Scott Brown has his hand up with probably a good illustration. Scott, would you like to share with the group?
Well, sure. Thanks, Jim. So for the folks that, as Jim mentioned, I'm the president and CEO of AD Vault. And we're based in Dallas, but we do a lot of work with MiHIN and with Velatura. And what I wanted to really do is not so much talk about us, but talk about the work that Jim is doing. And it is working because and Joanne, I appreciate you putting our mydirectives.com URL up there. So mydirectives.com is our consumer-facing advanced care planning module. It's free. Anyone in Michigan can use it. They can use it to upload their Michigan Advanced Directive or create an advanced care plan. But the work that we're doing with MiHIN, I'm particularly proud of, because whether it's this consumer-facing mydirectives.com experience, or whether it's the clinician-facing tools that folks from Making Choices Michigan are using to do their facilitation, create documents with Michigan citizens, and then upload them into our registry and repository so they can be found nationwide. I think we're accessible to about 90% of the healthcare ecosystem across the US. Or whether it's working with, I see some of the folks from hospitals in Michigan on this call. So, we have APIs that allow you. One of the questions that Joanne asked about was siloing. You all create good documents with people, whether you're in acute care or you're in ambulatory or home health or hospice or long-term care, and then they sit in a folder and they don't do you any good. And they don't often do the patient any good, as Jim was saying at the beginning. And so the work we're doing with MiHIN and with some of the folks here is to make sure that those documents aren't siloed, that they can actually be uploaded into our registry and repository as well. So they're available through MiHIN, through query and retrieve, seamless, easy, simple. There's a lot of burden, as Jim said, that goes into advanced care planning and doing it right. And so we see, Joanne, that it is working in Michigan, whether it's working with, we work with some of the healthcare payers, the largest payers in the United States, about getting their, especially Medicare Advantage, as Jim said, some of the older folks, getting them advanced care planning, getting them on our system. So whether it's with payers, whether it's with the providers in Michigan, we're creating an ecosystem of documents, high quality documents that Making Choices Michigan facilitators are creating and making sure that they're available across the continuum of care. And it does work. And we get over, I think, 140,000 queries to our system every 24 hours, and documents are being found. So I just wanted really, Jim, to congratulate you all and MiHIN and Making Choices Michigan on what you're doing. So it's great work. It's great work. And I would encourage you to keep it up, keep up the work that you're doing, because it's really wonderful.
Thanks, Scott. Jen, I know we're bumping up against it.
Yep, we sure are. It's 11 o'clock. And I really want to thank you. Our next download is September 21st, and we have our Bits and Bytes in September for anybody who's a Referrals Plus administrator. We're going to be going over our Referrals Plus reporting module training. I want to encourage anybody to write me directly with your questions, with your suggestions for any other topics. And more than anything, I just want to thank you for being here, and thank you for participating with MiHIN today. Thanks a lot.
Thank you all. Have a great day.